My name is Christian Rivera. I'm a public health inspector for the city of Framingham. I've worked for the city 2 years now. The kind of inspections are typically going to be housing inspections, they're going to be restaurant inspections. We'll do tattoo inspections, any pre-openings. Body art is the umbrella, and then microblading and tattoo is under that umbrella. So that's something we inspect and oversee. Do you have like the documents, like the record keeping documents? And perfect.
Here we go.
Beautiful.
Everything's here.
Everything is there. Beautiful. So you have your exposure control.
This is the informed consent.
Informed consent form that you have every client sign.
Yeah.
Read and sign.
Exactly.
Perfect.
So this binder has everything.
Yeah.
Everything.
Perfect. And you guys use disposable, right?
Everything.
Disposable.
Everything is disposable.
And how long do you guys keep the records for? Any kind of record?
4 years.
4 years?
Yeah.
Okay. Perfect. Thank you.
Oh, it just opened, but I'm planning to keep for 4 years.
Yeah. And then would you mind showing us like
setup?
Yeah, like a set, or you don't have to actually do it.
I just started, but I can do it again for you.
They do their plan review. We ensure that they provide floor layout. We'll go over everything. And then we want to ensure also that, all the artists have their own individual practitioner permit.
So I usually use 1 bottle for distilled water.
Yep.
And 1 for the green soap. We don't use green soap that much on the tattoo. We just like to clean at the end. But we always keep clean machines at the station. This is the glide that we use during the tattoos. So you have the ink caps. I do mostly like black and gray tattoos, but like I've been doing a lot of pops of color on them. So I always keep more ink caps if I needed to do color in the ends. And now just a lot of paper towels. Yeah, sometimes I use a whole roll.
Wow.
Yeah, during the day. And that was it for the setup.
Perfect. Thank you for doing that.
No problem, man.
My name is Brian Oram, and most people in the office call me Bean, and I am a public health inspector for the city of Framingham. I worked for the city of Framingham for a little bit less than 2 years. One surprising thing about public health inspections that the public might not know about is, number one, that we do things like animal inspections, marijuana inspections. We cover a large range of things, and people are often surprised when I say that that's something that I'm doing. When we're checking out the coop, we're just looking that everything's well kept, that they're providing all the necessary things to house a chicken appropriately, and they are within compliance. They have enough space for the chickens to graze, a covered coop for them to, stay within and be safe. Everything's good on our end. So animal control has a more direct contact with the actual animals, whether that's, mistreatment or they're not being fed. We look more at the structure. We look more at the setbacks of where they're living is set up, and more of a public health risk rather than the actual risk for the animal itself. So we're just measuring the distance from the house to the actual structure that the animals are living in. And we're looking for a minimum of 25 feet. And as you can see, we're already past that. So they're well within. The only other setback that we look for is the distance from the structure to any abutting residence. And usually we use an online map program called MapGeo. We use that to measure because sometimes we don't have permission to actually go on the abutting property. So that's how we usually measure that.
My name is Matt Lafort. I'm a public health inspector for the city of Framingham. I started working for Framingham a little over 3 years. Housing is the thriving force in Framingham, so we probably have about 3 to 4 housing inspections a week.
What we look for during a housing inspection is conditions deemed to endanger. We make sure that the doors lock properly, the windows lock properly to avoid unlawful entry. And then what we look for as well is water temperature, making sure it's hitting 110 to 130, so we'll give that a minute. We look for smoke detectors, make sure that works properly. We'll check the stoves in a minute as well, all the burners. We'll take a look at the fridge, make sure everything's kind of cold and working. Freezer, and then see what this looks like. All right, perfect. So it's 116, so that's perfect. And then we can take a look at the stove, make sure all the burners work properly. Perfect.
We'll just test out the outlet using this device. It has the directory here. 2 yellow lights on the right show that the outlet is working correctly. So let's test it out. There you go. Working perfectly. All right, so we'll test the smoke detector. It works. We're good.
Hello, how are you?
Hi.
Good, thanks. My name is Matt. This is Brian. We're from the Framingham Health Department. We're here to perform a routine inspection of the pool today. Perfect.
Thanks.
We're looking for basic stuff here, make sure they have the buoy, making sure all the chairs are at least 4 feet away from the pool itself. We're going to test the 911 emergency phone, and we're also going to check out the pump room. Make sure the address that comes up on their caller ID is the address for this pool in case there was ever an emergency. This is not an emergency. I just made a call prior to you guys. This is Matt calling from the ALOF testing the 911 phone. Can you please tell me what the address is on the caller ID? Perfect. Thank you for doing that. Have a great day. What we check for in a pool inspection, obviously we have the headboard here, and what we want to do is we want to make sure things are actually protected if they were ever to use it. The ropes are nice and tight. It's good. Lifeguard bow, which is good. You want to make sure it's not in disrepair. Everything's in its place to be used, which is good. And then here we're just checking to see if it's Coast Guard certified. So this is the filter room. We want to make sure that on the application what they put for their filter, whether it's cartridge, whether it's sand, matches up with the filter on site. We also request the pool record log. They're required to test the pool records at least 4 times a day. So we're going to come over here, we're going to ask the PIC to provide their records, which they're doing, which is great. They're doing more than 4 times a day, which is awesome. Other stuff you'll see in the filter room is PPEs, which they're required to have in case they were going to have any accident. They have an eye wash station here, which is a great practice. And they are required to have their test kit on site to test the chlorine. We want to make sure all those chlorine levels are obviously within range. Safety, safety, safety. And the main goal for the inspection is to make sure the pool is a safe environment.
The filter over there, we change it every 3 months. But every change 3 months, I clean up the machine. We have a company for pest control coming every 2 weeks.
Every 2 weeks? Oh, that's great, Marcelo. Very
2
frequent.
weeks, yes.
All right, so this is a walk-in refrigerator, and something as an inspector we would look for, maybe potential foods that are cooling. So when we start the inspection out, we'll ask the PIC, are you currently cooling anything? Yeah. What we're looking for here right now is, proper food storage. We want to see the raw chicken by itself, the beef by itself, which is great. So he's got all his raw chicken right here, which is great. His beef's over here. The chicken is underneath the beef, which is the proper storage. It's all being stored on the same shelf. And then everything else is looking really good. Everything's 6 inches up off the floor. So awesome storage. So all cold food must be stored at or below 41 degrees Fahrenheit. The menu should have asterisks next to the disclaimer and next to the food item that's offered undercooked, like a medium hamburger or eggs over easy, so the customer can line those up. And so if they're doing times of public health control, they're required
Yes.
to take notes and logs,
Yes.
which they're doing, which is
Yes.
great to see. And not all foods get approved for this. This is something that they applied with us. We
Approval.
approved it.
Yes.
So now we know they do this. So when we go out, we want to look for their logs. I just hope, that they know we thrive to, have a safe public health environment in the city of Framingham and recognize, the hard work that we do. We are involved in a lot of different things.
I honestly love my job. It's always busy. We're always constantly learning, working with people to kind of get them to a place that they want to be in. At the end of the day, we're serving the public, so we're here to help.
One piece of advice that I would give to an aspiring public health inspector is to just try, if you're interested, just give it a try. The inspectors in my department come from all different backgrounds and different experiences in terms of work, in terms of life, and we've all found our way within this role. I think to become an inspector, you don't need a certain skill set, you don't need a certain level of knowledge. I think you just need a certain mindset and a certain care for the community to actually, carry out that role.